Hello, how are you doing? We get ready to have another really good segment. I did a show, I think it was a segment we just recently did, and we talked about the allopathic universe and the homeopathic universe, and how they were two different universes, but they need to be together. And we had Dr. Henri Lamothe on the new Ministry of Health, who he is a part of the new Ministry of Health. He's a part of my medical records, all these different things. And I think we need to understand who he is. You need to understand, I need to understand who he is, and how we are privileged to sit down with a doctor who has all these different things happening, and his heart is for the people. So having said that, this is going to be, once again, if you can tell, all of our stuff is very organic. We're just going to flow, and we're going to see what happens. And so I'm going to look over here and say, Dr. Henri Lamothe, I appreciate you being here, Henry. Thank you so much, my friend.
Thank you very much.
Talk to me. What are you doing? What are you bringing to this whole health care thing that we're doing? What are you doing?
I think it's important when you start with a concept that is an out-of-the-box concept of the delivery of care process, that you may feel as though you're going against the grain, but it's easier to encompass a number of ideas. Mm-hmm. And we had spent much time with Dr. Lawrence, mm-hmm. yourself, and developing a healthcare concept that includes a delivery that has both spiritual, mental, and physical attention to the individual. And they expand that to the family, and that's what you call a comprehensive healthcare approach. And that should be used in any illnesses. Now, when you bring something as important as a newer concept in a healthcare delivery system that is so vast, it's in every country, it occurs with millions of people, you need to have a machinery behind it, a machinery that is very systematically introducing it to the world, and introducing it to the world in a way that makes sense. And I want to take this opportunity to inform the audience that I've just received the certificate as a minority company.
Wow, now it sounds good, but tell me, what does that mean? Really?
I am now a member of the Greater New Haven Minority Distribution Council.
Wow.
Which brings together a forum of lots of minority companies to exchange ideas. And it's a platform that's backed by large companies, billion-dollar companies, that supports the process whereby minority entrepreneurs can have a leg up and a help and tutelage so that they can at least compete in a very competitive world of business.
And what is it going to allow you to do?
That will allow me to interact with other minority companies and be at least visible to a large forum of nationwide organizations in starting up projects. And as such, that allows me the opportunity to introduce to you the machinery behind the concept of a comprehensive healthcare. And that machinery is an organized process of specific companies with specific tasks, and you'll see shortly how this will systematically grow and publish itself in a way that it backs up what it claims to back up, and produces a group of companies that encompasses the marriage, so to speak, between the homeopathic and the allopathic medical world.
Let me ask you, what is, and that sounds wonderful. First, you're using the word comprehensive. Why are you keep using the word comprehensive when you talk about the healthcare system?
I happen to believe that the single focus on just allopathic medicine for any ailment and treatment is short-sighted. It just does not, it's not comprehensive. There needs to be more to it than that, because there is more to it than that. As we talked about in the previous segment, the tripod of stability, of homeostasis will be important. So on that note, let me introduce to you what I brought to the table.
Please, talk to me.
So PHL Physician Services is now a recognized minority company, of which I'm the CEO and president. It is a limited liability company that brings an umbrella of multiple areas. Let me start with the first, which is not the most important, not in that order, but the first is the fact that we're dealing in a world of science. And as such, science needs to speak the scientific language. And when we bring illness and ailments to the table, we need to have the proof behind it.
Okay.
So PHL Medical Research Group will be a formation of a number of scientists who are behind the study of the science of the homeopathic world,
Really?
the hemp world. So we're set to do protocols and research studies and comprehensive evaluation of the medical, psychological effect of the hemp plant products, the terpenes. That is an organization that's going to be purely scientifically based, set to study multiple facets of the effect of the hemp plant product. In addition to that, publish it to the rest of the scientific world so that we can speak their language too in terms of scientific proof behind what we say.
Tell me, where is this fire coming from? I can hear it. Where's this? You're a doctor, and where is this coming from?
You have to be a free-thinking physician, free-thinking scientist, because that's what this is all about.
Okay.
That's one of the 5 organizations that are going to be put together in the PHL Physician Services.
Really?
The second is going to be a PHS Concierge Group. That Concierge Group is set to understand that every time there's an interaction where a patient needs to go to a physician, that interaction should not stop when he or she leaves the office and closes the door. That interaction should not stop. An intervention should not stop when they leave the emergency room and close the door. There is a vast area of unknown. What am I supposed to do? Who do I call at 2 in the morning? Am I feeling okay? Am I getting better? Am I getting worse? And this is all after you have a treatment plan in place.
Listen, you're talking to me, man. I get it. Go ahead.
So the concierge service is set to facilitate referral services. It includes a number of services that includes visiting nurses, physician assistants, at least phone-to-phone interaction.
And here's what I want to ask you. I've been wanting to ask you this because this is making me, and I want y'all to hear this, making me very excited. Because what you're saying, and you tell me if I'm getting this, you're saying, Deron, with this system, you go to your appointment, but you will have a group of trained people who understand there's an entire process that a patient goes through. And it doesn't end with just leaving the doctor. And because I know I left with a lot of questions, but I didn't know who to ask. And you're saying I'll be able to talk with someone that'll take me through that?
Exactly. That's a concierge service that is for everyone across the board.
That's good, man. I believe it is really good. I say it sounds too good to believe, but it's good.
Well, it's all encompassing because this is where you think about spiritual health. This is where you think about how it affects the healthcare giver in the home. You come home, you have a healthcare giver, you have a family, you have your children. All that is part of the healing process, and the healing process doesn't stop when you close the door. So that bridges the gap that exists today in the healthcare delivery system. That becomes a little bit more comprehensive in what you present. And the concierge service will be part of a secondary group of businesses responsible for that transition of care across the board.
I finally get it, and I'm telling you, I'm feeling relief just hearing that, because the healthcare system, since we've been doing it, it's a no man's land. You're out there, and you don't know what to do, and every step is like a step in the Thunderdome on the way in the desert, and every step you're not sure, am I going to make it on this next step? So I really appreciate what you're doing. Is there a couple of more things?
Oh, there's a few more.
Oh,
there's
come on,
a few
talk
more.
to me.
We're not done. PHL Consulting Services focuses on the emergency part of the delivery care system.
Okay.
There are thousands of emergency rooms. Every time you feel that you have an emergency, you introduce yourself to a group of physicians in an emergency room setting through the process of taking care of you. Well, that process in and of itself is a daunting process. You walk in the ER, you feel ill, you're not sure what's going to happen. The first thing that happens is that you're scared.
Right. Terrified.
You're terrified. You need to be met with the individuals who are going to ease you into the process.
Right, right.
Not only that, but you have to sit down and fill out thousands and thousands of forms of information that you need redundantly, because every time you go in, you need the same thing. With that concept, the emergency room process is a journey. It's a journey where you enter not an area where you're scared and intimidated, and there's a new language involved. Yeah. There's all kinds, the medical field is full of that language that tends to separate the individuals. You know, some of the patients say to me, "Doctor, speak English. Talk to me."
Right.
You've gone into this world, and we don't realize we do it. So we ease the process by having individuals within the emergency room process that helps promote the flow.
Now let me ask you, what qualifies you again to understand the emergency room process?
Well, I've lived it for 30 years. I've seen the bumps in the road. I've seen the dips and valleys. I've seen what works and what doesn't work. And we don't have to reinvent the wheel here. We just need to smooth out the process and put the patient first.
How long you been meditating and thinking on this?
I've lived it.
You've lived it. Okay.
I've lived it. The most important part about that is a flow pattern that goes through the emergency room. And if you present yourself with the idea that you have your own medical record at hand, that takes away a tremendous amount of time that the physician spends trying to guess who you are, who you've been, because you are a history of medicine in and of yourself. You've been in Kansas, you've been in LA, you've got interaction with doctors there. When you show up in the emergency room in New York City, they don't know what happened in LA. And at 3 in the morning, who's got that information?
Right.
Whose information is it?
Right.
Yours.
It's mine. I'm supposed to own this.
And you're supposed to own it. So the medical record that invites you to be the individual, the owner of your medical records, will facilitate the process of the emergency room experience.
Right.
So in that, the physician services arm of this all-encompassing process will deal specifically with patient flow, ease of transfer of information, and be a consultative service for all emergency room so that we don't have to reproduce the same mistakes and just ease the process across the board.
Right.
The experience will be better for the physician, it'll be better for the patients.
Can I ask that you also put, and you probably also thought in, the checking out process of the emergency room?
Well, you never check out.
Okay. What do you
because
mean by
you
that?
got the concierge service easing your way out.
Wow.
The door does not close when you leave the emergency room.
Wow. Let me tell you why I'm saying that. When I was trying to figure out what was wrong with me, I had to go to the emergency room at a university hospital. And they had to guess what was wrong. And they tried to give me some kind of chemical that would freeze. I would put it in my nose and it would freeze my brain and make the pain go away. And they just released me. And I was sitting, my wife, we were in the hood, and my wife was sitting there. And I was sitting in a wheelchair waiting for her to get the car. And I was like, now what do I do? I have no idea what happens. Had I been able to talk to someone, because then the very next day, when the doctor who sent me to the emergency room found out that they had sent me back, he called and said, listen, y'all better take this man in right now and look at him And then he sent them my medical records. I'm just remembering that now. And when he sent them, they said, okay, we're going to deal with this. We're going to make this happen. And so that is going to be y'all listen to me. I know what terror is. Nobody can explain to you what the man who was on point is now having to allow his wife, the caretaker, to take care of him. And they roll me out in a wheelchair in a drug-infested neighborhood. And my wife has to go find the parked car by herself because we can't get Uber or anything. And I was terrified because I couldn't get up, I couldn't move, and I didn't know what to do. And so when you tell me this, I'm holding back tears because I'm very emotional. You know that. But this is a game changer because, again, the emergency room, that's where you get the care, but it's a no man's land. And I can hear, because I've had to go so many times, hearing doctors say, do you have his records? Hearing female doctors, do you have his records? Where's his records? And we're waiting. And it takes forever. But what you're now saying and what I'm understanding with this, my medical records, it's going to be on my cell phone. And all I got to do is just give them a code. And please tell me this is true. I'll be able to pick up a call and say, hey, I'm here. They're sending me home. I've got all this process. And I'll be able to talk to somebody.
Absolutely.
It's a game changer, man.
Absolutely.
I'm just glad. What else you working with? Well, you done already blew me away, but keep going.
The other arm of PHL Physician Services, I'll call it PHL Holistic Partners.
Okay.
This is where the concept of having other forms of healthcare delivery processes throughout the ages are not to be forgotten.
Okay.
There's value in bringing together a forum of individuals whose care is just as important, such as acupuncturist, chiropractic medicine, meditation, yoga, physical exercises and therapy.
Can you explain it to me again? I'm still not getting it.
Well, all these fields are there to help other folks deal with whatever ailment they may have that may not have been addressed through the allopathic medical path.
Right.
So what we're doing is providing those services that includes, for the individuals that may fit those services, an additional form of treatment, such as meditation services, such as yoga, chiropractic medicines, acupuncture. They're there to take care of symptoms and ailments as well.
Right. I got
So
you.
let's not forget them. Let's encompass them. Let's bring them all in and be part of our comprehensive medical care process. And through PHL Holistic Partners, we will be able to provide the patient through the concierge service an additional form of therapy that may fit his or her needs.
Right. And so what you're saying is there's going to be an organization of like-minded people who believe in all aspects of health. And they'll be able to, you're going to build a community of doctors and professions, because I had to get acupuncture. I thought it was psychosomatic. I felt so good for 3 days and I had so much energy. I said, this is incredible. And so what you're saying is that I wouldn't have to be on my own. I could just...
It'll be comprehensive.
That's great.
It'll be right there for you. And it will be a process that's really a paradigm shift in the healthcare delivery system. It is a paradigm shift in part because we're now not narrow-minded. We're broad. We're encompassing. And we'll do it in a way that there's nothing else but a group of individuals and professionals, allopathic, homeopathic, traditional, non-traditional, east meets west, north meets south. Let's bring it all together to provide you with the ultimate experience of bettering yourself.
Facts. Why do you care for the patient? Because facts, why?
It's a calling.
It's a calling.
Once you become a patient, you'll realize where the system fails to address many issues that you think about that would be much more comprehensive. Because as much as you, and I've listened to patients leave and say, wouldn't it be nice if, wouldn't it be nice if, or they come back to the emergency room, wouldn't it have been nice if that was done, I wouldn't have been back here. So you listen, and they'll tell you exactly what's missing. So in that process, the comprehensive nature of what we bring under PHL Physician Services is, again, multiple subsidiary organizations that deals with the objective, the scientific, the homeopathic, the allopathic, and also going through the internal process of the ER experience, having my medical records be part of the process that eases the information through a concierge service within and without the hospital. You're not alone.
Listen, and I'm going to say this. As soon as you say, I'm thinking about the movie John Q with Denzel Washington. I have yet to be able to bring myself back to see that again. I haven't seen it since I saw it years ago. But when you say you're not alone, the most alone moment, one of the most alone moments I had was sitting in the middle of my couch after talking to the drug company and talking to some other people and saying, what do I do with this? And I had no one to call. And I sat there and I wailed because I said, I don't know what to do. And I didn't want to put the pressure on my wife. I didn't want to call my daughter, who's a physician. I just said, because I don't know what to do.
Well, Deron, no mask, no mask, no mask. No more should you go through this.
Yes.
I think we have spent a tremendous amount of time in the healthcare delivery system to understand where its pitfalls are, and we're just here to fill the gaps.
Okay. Well, I want to thank you once again. And listen, as long as we are talking, you're going to honestly hear me say thank you, because the answers and the wisdom that you brings health to me, and it reduces my anxiety. I appreciate you being here. Listen, guys, I thank you all for tuning in to the new Ministry of Health. If you want information on my medical records online, make sure you check at the website on what we're talking about. But I want you to know this is a game changer. The new Ministry of Health, where we believe in the journey to wellness and truth. Talk to you soon. Love you, and I beat you to it. And once again, thank you.
Thank you, Deron.
All right.
Thank you.